CLIA 88 overview. There are four main components of CLIA 88. There is a WAVE testing program, federal laboratory regulations, good laboratory practices, and general quality assurance requirements for all tests. CLIA 88 stands for Clinical Laboratory Improvement Amendments of 1988. CLIA 88 requires all labs examining materials from a human for diagnosis, prevention, or treatment to be certified by the Secretary of Health and Human Services. This is to ensure the quality of laboratory testing by enforcing laboratory standards. It ensures accuracy, reliability, and timeliness of patient test results regardless of where the test is performed. There are three different categories of laboratories, certified according to the kinds of tests that they perform. Low complexity tests, also called WAVE tests, moderate complexity of tests, and highly complex tests. Highly complex tests are usually tests that use sophisticated instruments, have a high degree of interpretation by testing personnel. There is a formal education that is needed with a degree in laboratory medicine. Proficiency testing is required. On-site inspection is also required, and competency testing is also required. Moderate complexity is more difficult to perform than WAVE tests, requires documentation of training regarding test principles, instrument calibration, and quality control, and also requires proficiency and competency testing and on-site inspections. WAVE tests are low complexity tests. They are easy to perform and interpret, and typically have little risk of error in these tests. They require no special training. End users must follow package, insert, and manufacturer's instructions. Typically, medical assistants are able to perform WAVE testing. Categories of the laboratory tests under CLIA. These complexity categories were determined using the following criteria: risk of erroneous results on patient health, degree of knowledge needed to perform the test, training and experience required, complexity of reagent and material preparation, complexity and number of operational steps to perform the test, calibration requirements, troubleshooting and maintenance requirements, degree of interpretation and judgment required to report results, and the availability of proficiency testing materials. Purchasing a CLIA certificate. In addition to following CLIA regulations, any area that performs laboratory testing must purchase or be covered under a certificate or license to perform the testing. There are four different types of CLIA certificates. There's a certificate of waiver, certificate of PPM procedures, certificate of compliance, and certificate of accreditation. WAVE testing certificate. Simple tests that don't require a high degree of educational background to perform. Some WAVE tests include glucometers, urinalysis strips, some strep A tests, pregnancy tests, and hemoglobin testing. And there are a whole lot more WAVE tests, and there's a whole list in your textbook. Even though WAVE tests are simple to perform, they still require basic quality assurance such as training, annual competency, and quality control. A PPM certificate is a provider performed microscopy. This category is considered a part of the moderate complexity category, but is accorded specially considerations by CLIA. This category contains a small group of tests that are performed as part of the physical exam by physicians, dentists, nurse midwives, physician assistants, or nurse practitioners. Some examples of a PPM certificate test would be a sperm analysis, a pap smear, the tests under this category are not subject to routine 2-year inspection, but basic quality assurance such as training, quality control, competency, proficiency testing are still required. This license can only be purchased if testing is performed by the above personnel and only for a small group of tests. The certificate will also cover all wave tests since it is considered a subcategory of moderate complexity certificate. Here's a list of some more testing for the PPM category: Fern testing, qualitative sperm analysis, KOH preps, pinworm exams, urine sediment examinations, nasal smears for granulocytes, wet preps, fecal leukocyte exams, and postcoital direct qualitative exams of vaginal and cervical mucosa. Testing under this license is allowed only if performed by the specific personnel. If staff, nurses, and technologists perform testing, a moderate complexity license must be purchased and 2-year inspection is required. Certificate of Compliance and Accreditation. Moderately and high complex tests. This category contains tests that require more educational skill, more complicated steps, and can cause a greater degree of harm to a patient if performed incorrectly. This complexity level has more stringent regulatory requirements than waived. Good laboratory practices. Under CLIA, all categories of testing must be met, and in regards to quality assurance and safety. In addition, if inspected by an outside agency such as JACO or CAP, a lab or area must adhere to any additional standards established for each category by inspecting agencies. Some of these CLIA and JACO requirements involve patient testing management and quality control. Good laboratory practices. Quality assurance must have a written QA program. Procedures must have written procedures of how to perform the tests, and procedures must be reviewed annually. Personnel requirements must meet CLIA established educational requirements and must have an established training and competency program. And use of testing. The organization must define how tests are used, either as a screening, monitoring, or diagnostic test. These are general QA standards that should be followed for all laboratory wave tests. Quality control procedures should always be performed according to the written procedure. Quality control must be performed before testing a patient sample. And typically most healthcare facilities will do their quality controls the first thing in the morning before the clinic even opens. Patient testing must never be performed using kits or reagents that have failed quality control procedures. All wave testing should be performed correctly according to written instructions. Staff performing testing must have documented training prior to reporting all patient results. Refrigerator and freezers where supplies are kept should be monitored on a daily basis and have written records maintained. These refrigerators and freezers have usually either one thermometer, and sometimes in some facilities they require 2 thermometers, and basic daily monitoring must fall within a certain criteria, and those are in written records, and usually those records are hung right on the refrigerators and freezers. Whenever a new box, bottle, or kit is opened, the date opened and the date it expires should be written on the box or bottle. Once a control is open, the expiration date is not the date stamped on the bottle. It is often usually 30 days or 60 days of expiration after opening. Typically it's 30 days. Test kits and controls should be stored according to manufacturer's instructions. Never use expired kits or controls to perform testing. Using expired kits can result in inaccurate patient test results being reported. If the expiration date is not written on the item or the foil pack, example is pregnancy, was left open or unused, when in doubt, throw it out. Otherwise, you may be wasting valuable time trying to make controls perform, or worse, you may get a report of an inaccurate patient result. Always properly identify patients prior to the collection of blood or bodily fluids for testing. So the patient's name and then a second unique identifier. Always label blood tubes, urine specimens, throat cultures. Never assume that you will label them later. This can lead to unnecessary recollection and results reported under the wrong patient. When performing wave tests, always label any test devices, cassettes, hemocult cards into which the patient specimen is introduced to the test. If you leave an unlabeled test on the counter and someone else does too, you may not know which one is which. Always document results in laboratory wave tests in the patient's medical record using established protocols. It is the law. Always perform any maintenance such as cleaning that is required in the instrument prior to performing patient tests and when required. As a result, is only as good as the instrument it is performed on. Use any and all information that is available to you. The laboratory procedure manual is a good reference. Wave tests and any additional informational charts, posters, etc. These are provided to help you. So is it okay to use tests past their expiration date? If it is just 1 or 2 days, false. Kits should not be used past their expiration date. When a control is open, it always expires on the date that it is stamped on the bottle. That is false. Often the bottle is open and the expiration date changes to 30 days past the opening date. All tubes of blood, test devices, aliquot specimens, etc. should be labeled with the patient's medical record number and the name. This is true. Not labeling tube specimens or test devices can lead to patient recalls or worse, the wrong results reported on the wrong patient. Number 4, you don't need a certificate license to perform only wave tests. That is false. A wave testing certificate is required to perform wave testing. Number 5, quality controls need only the tests to be tested when you think the patient's test results is incorrect. That is false. Quality controls on 2 levels, both a positive and a negative, must be performed at least once every 24 hours that the patient testing is performed. Number 6, training does not have to be documented, just performed. That is false. All training and competencies must be documented for JACO. Number 7, annual competency is required for all staff performing laboratory testing. That is true. Number 9, medical technologists and staff nurses are allowed to perform PPM tests under a PPM certificate. False. Only special personnel such as physicians, dentists, nurse practitioners, physician assistants, and nurse midwives are allowed to perform this testing under a PPM certificate. If medical technologists and staff nurses perform PPM testing, the area must purchase a moderately complex certificate. Number 9, quality control should be performed and compared against acceptable ranges before performing patient tests. That is true. Number 10, competency must be performed annually for all wave tests. And that is true.